Hi, everyone. I hope everyone is doing well. Hope no one's feeling ill and you're not going stir crazy at home. I'm not. Been pretty busy getting used to this distance learning. I wanted to tape video a little bit of information for you for the oncology chapter that you're going to be doing this week in AAT. I wanted to point out the sections of the PowerPoint that I thought you're most likely to hear and see when you get into practice. You're still responsible for the chapter as usual. There will be handouts that you'll have to complete, but I thought at least I could, just connect with you a little bit about what I think are the more important, more interesting components of this particular chapter. So, first of all, it's chapter 16 in AAT, and oncology technically translates to the study of tumors. Onco refers to tumors. There is also, I wanted to let you know that specifically in oncology, there is a position. It's called a cancer registrar. It's an associate's degree program in cancer registry management. If you find that you think you have a particular interest in oncology, you take this program and the program is put forth by Cancer Information Management, or the NCRA, National Cancer Registrars Association. And in some areas, you could earn up to $30 an hour. So, and this is a position where they keep track of all different types of patients who are diagnosed with cancer, their prognosis, prognosis, and a lot of other statistical data in order to track different types of cancer. So that might be something that somebody might be interested at one point in time. Thinking about carcinogenesis, ways that cancer develops. One is through the environment. Remember, we talked about asbestos, different types of diseases of the lungs, asbestos, smoke for lung cancer, UV rays from the sun for various integumentary cancers. And there are others. Certain types of pathogens can develop into cancers. For instance, hepatitis. Hepatitis is often identified as a sequela of liver cancer, so it's critically important that any patient you come across who has hepatitis C or particularly hepatitis B, they're going to be monitored for liver cancer as time goes on. One of the reasons why we have the hepatitis B vaccine, and also for cervical cancers, we have the HPV vaccine for a cervical cancer. And then there are other genetic considerations, breast cancer, ovarian cancer. There's a link between, mothers, aunts, close female relatives that may have breast cancer. Their female offspring are often at a higher risk of developing those same types of cancers. You've heard of BRAC analysis, BRAC, and it's a DNA type of test that will identify on an individual if they seem to have a genetic predisposition for certain types of cancers. A lot of women have taken that BRAC analysis and based on those results chosen to have preemptively mastectomies or oophorectomies, have their breast or their ovaries or other reproductive organs removed so that they don't develop those types of cancers. Angelina Jolie comes to mind as one several years back because of her DNA results that came back, as well as, her mother apparently had, I forget if it was breast or ovarian cancer. So that's something to think about. There are 2 slides that talk about normal cell growth and oncogenesis, the development of tumors, cell tumors versus normal cell growth, that I think are kind of interesting. There's a term called apoptosis, PTOSIS, which we know typically refers to drooping. In this case, it refers to falling, which isn't that falling off of, or drooping away from, I guess you could say. And what happens is a particular cell becomes diseased or hyperplasic or dysplasic. Hyperplasic is the development of more cells. Dysplasic is bad, painful, difficult. In this case, it would be bad cells become hyperplasic, and they begin to proliferate, causing cell tumors, causing cancerous tumors. You've all heard the term metastases. Metastases means to spread. It's usually not necessarily a good thing if a patient is diagnosed with a cancer that has metastasized. Usually means that has spread to other organs, which is going to make it more difficult to treat, and contain. There are different types of malignant tumors. I think it's slide 9. And depending on the term that you hear, should you want to, have in the back of your mind the type of tumor that's involved. So, for instance, a carcinoma is a tumor either of an organ or a gland, and it would have the term adenoma in it, versus one that's epithelial based, and it would have squamous. So there's a squamous cell carcinoma that originates from epithelial type of tissue, and there's an adenocarcinoma of the lung, which would be a cancer that develops from glands within the lungs. Sarcomas involve connective tissue, typically bone. You may have heard of Ewing sarcoma, EWINGS. Ewing sarcoma is a cancer of the bone. It's often seen in young people. Lymphoma, related to the lymph vessels and glands. Leukemia, we tend to think of it as a blood cancer, but it really originates from bone marrow, versus myeloma, MYELOMA, not to be confused with muscle, but MYE, bone marrow. Myeloma originates from plasma cells within bone marrow. And then there are what they call mixed cell tumors. They're a combination of any of those types of cells. Benign and malignant tumors, the way they determine has to do with how slowly or quickly they grow, what the cells look like under a microscope, the spread of the disease, if it's recurrent or not, recurrent breast cancer, and pathogenesis, where the tumor and the symptoms relate to the location of the tumor. For instance, it could be obstructive. It's obstructing or impeding, or it's compressing on certain tissues or organs. sometimes a patient may be diagnosed with a brain tumor that's not life-threatening, but it's not accessible because it's so deeply embedded within the brain. In order to extract it, they'd probably do more damage than good. And then finally, staging and grading. Grading assigns a value to the degree of the differentiation of the cells. Staging measures the size and the spread of the disease. So you'll see a number, TNM, or a term called TNM, which refers to tumor, nodes, and metastases. So you read through that section. There are signs and symptoms of different types of cancers, and you'll see some of the terms in your reading about what each of the terms refers to. Then the PowerPoint goes through each of the different body systems, and it identifies some benign types of tumors for each body system, and then malignant type of neoplasms, such as in the integumentary system, melanoma, we know, is typically a malignant form of cancer versus, a dermatofibroma. Let's see. So we'll go through several slides of each of the different body systems. You'll come to slide 26, terms related to diagnostic procedures. So there's several different ways cancers are identified. The patient's history, the patient's signs and symptoms. Smoking is pretty much related to any type of cancer that develops. Different tumor markers. Now, tumor markers are often chemicals, blood tests that are done in order to assess a patient's development of cancer. Biopsies will be done. There'll be all kinds of diagnostic imaging, and then, of course, self-detection. Often a patient will notice something different, bring themselves to the doctor. And then you'll get to the different types of tumor markers. Ones that I remember seeing, AFP, alpha-fetoprotein, that's one that's done not so much as a tumor marker, but it's done in a pregnancy, usually around 24 to 28 weeks. When they do that in a pregnancy, they're looking for a genetic marker, typically for Down syndrome or other types of neural tube defects, but it also could be an indicator of testicular cancer. CA125, that only became available, like in the last, 25 or 30 years, and it's one that they use to manage ovarian cancer. There are some that look at, that are used after a patient's been treated in order to manage a patient's response. So take a look at this couple of slides on the different types of tumor markers. PSA, we talked about, prostate-specific antigen. That's one that is done on males in order to monitor a male for the development of prostate cancer. There's several slides on different types of imaging. We've talked about some of the different types of imaging in other chapters that we've looked at. You should know the terms related to self-detection. There's an acronym, CAUTION, and you can read through what each of the letters in the acronym stand for, as well as remembering for skin cancer, the self-detection, the ABCDE rule. There are several slides. There's a slide on different types of surgery. different types of radiation therapy or radiotherapy. I'm sure you've heard of people who have had to have chemo as well as radiation therapy, and a bone marrow transplant, that would be another one. And then preventative measures, as I mentioned earlier, hepatitis B vaccine and HPV vaccine are used as preventative measures for some of these. And then you'll see there's only like 5 or 6 clicker questions at the end that you can go through and identify the correct answer. So those are the highlights of the oncology chapter. And your assignment includes reviewing the PowerPoint chapter. There's handouts to be done, and I will likely post something on Schoology, an assignment or a test on Schoology, maybe next week. So I hope that's helpful to you. And also don't forget to, work on the student resources on the Evolve website. I think those are always pretty helpful. And that's about it. So spend some time on this, and good luck.